It's a little past 9, so we will go ahead and get started. Thank you for being here. I see a lot of familiar faces. I'm Shannon Decker. I'm the executive director and co-founder of a nonprofit called the Speedy Foundation. We are based in Idaho, Utah, and here locally. Our mission is suicide prevention and mental health awareness. And starting in about 2017, we started to expand into incorporating Narcan and opioid overdose trainings into our mental health first aids. And so I have partnered with Nevada County, and we are offering free trainings to organizations and just different community populations that are interested in learning more about opioid overdose, prevention, intervention, and some of the harm reduction strategies. So Devin Bradley is also here with Nevada County, and so he might have some more to contribute. But I have a very brief presentation. We're going to try to get this done in about 30 minutes. So I appreciate you being here. Today we're going to be talking about, if you want to slide, I'll get used to having to call out slide. We're going to learn about the background and the causes of opioid overdoses. We're going to talk about some of the signs and symptoms that somebody could be exhibiting during an overdose. We're going to talk about Narcan and how to use Narcan. We're also going to talk about fentanyl testing strips very briefly, but we have those available here too. And we're going to talk about the prevention resources that are here in the community. Gateway's here, and they also have some work that they're doing with Nevada County, and we have some additional resources like from the hospital. Slide. As we talk today, I want you guys to think about some things. I want you to think about who needs to receive this type of training. Is there some piece of this training that really should be emphasized for our community or for the experiences that maybe you've had? There might be some information that's missing or needs to be clarified. I'm not pretending to be an expert. A lot of people who do these trainings come from a lot of lived experience, and my experience really comes from suicide prevention, and this has come into my world. So I just want to share that with you. That's my viewpoint from it. I want to know what you find most valuable about the training and where in the community we need to have Narcan and fentanyl testing strips. So today we're going to talk about key terms. We're going to talk about opioids, fentanyl. We'll talk about the local impact in Placer, Nevada County. We're going to talk about harm reduction as an approach. We'll do a very brief Narcan training, very brief fentanyl testing strip training. We're going to look at some resources. We'll review the objectives, and we'll be out the door. So some of the things that we'll be talking about are opioids. And for some individuals, maybe they haven't had much experience with it. So the basics of it. It is a class of drugs. It interacts with the opioid receptor in our body, on the nerve endings in our body and in our brain. Fentanyl is a type of opioid. It has a very high potency. It's used both medically and in recent years recreationally. And that's what we're seeing a lot in the news, in the headlines, and maybe in your lives. Narcan or naloxone. Narcan is a brand of naloxone, which is the drug. And this can help reverse the opioid overdose. And we'll talk about exactly how that works. There's also something called a Good Samaritan law. This is a state law that's been set up in almost every state that I know of. I don't know of any state that doesn't have a Good Samaritan law on the books at this time. But in California, it protects people from getting in trouble if they report an overdose to law enforcement under certain circumstances. But our goal is to inform people that it's out there, that it's aware, and that we don't have to be afraid to get people connected to help if they are overdosing. And then there's other drugs. We'll talk about some other drugs that are non-opioids, but they might come into contact with fentanyl or other opioid substances. Slide.
What is it, opioid?
What? Yes, yeah. So opioids are a class of drug, illicit drugs like heroin or synthetic opioids like fentanyl. And then there's legal drugs available by prescription, like oxycodone is one that maybe you've been prescribed after a surgery. So these are all kinds of generic or brand name opioids that maybe you're familiar with. If someone were to overdose on any of these, Narcan, naloxone would be the antidote to bring them out of opioid overdose and get them connected to emergency first response care. Slide. So if you had a chance, there was an awesome video that really went into the science behind what does addiction to an opioid look like. It was this cartoon character named Susan who fell off a bike and became injured and started being prescribed opioids to treat her pain. And so from a very non-judgmental lens, it's, I think, a good video. It's less than 5 minutes on what does this really look like. So if you haven't had a chance, definitely go back and take a look. We'll send the link again in the meeting notes. But an opioid are those chemically reacted pieces that are interacting with your opioid receptors on your nerve cells that happen in your body. And it helps to reduce the perception of pain and increase the feelings of euphoria and pleasure. Slide. At a low dose, an opioid just really makes people slower or sleepy. At higher doses, it's going to slow down your breathing, your heart rate, your functions for living. And during that overdose, the major concern really is the lack of oxygen to the brain. When our brain stops receiving oxygen, that's where we're receiving damage. And so if we think about how long can our body go without oxygen, that's why the urgency of becoming equipped to be first responder with Narcan is so important. Slide. So the next video that was sent ahead of time, and if you haven't had a chance to watch, I really encourage you to do so. This was a video that is a little over 10 minutes, but it really goes into the history of opioids in the United States. And I think it's a big aha moment that we didn't begin an opioid crisis in the 70s with heroin. Our opioid addiction started way back in the Civil War with morphine. It started in urban areas with white middle-class individuals starting to become prescribed. It happened when the Bayer Corporation introduced heroin as a painkiller, saying that it was less addictive than morphine, all the way up into the 70s, where heroin was being cut and it really started to get into the low socioeconomic, much more into Black and Hispanic neighborhoods. That's where a lot of the stigma was formed around opioids. And then this video was created in 2017, and so it doesn't even begin to talk about when fentanyl hit the market and what's happened with fentanyl. Slide. This comes from the CDC to show the trend in overdose deaths involving opioids. We can see that there is a huge spike that's happening with synthetic opioids, which is why we're talking about fentanyl and really here to take a look at fentanyl testing strips. Slide. So since fentanyl, it's that synthetic opioid. It's between 50 and 100 times as potent as morphine. It is medically used in hospital systems, in healthcare, for pain management, especially after surgeries and for cancer treatment. The image that we have here is a little vial, and for a person who does not have any opioid tolerance, that vial contains enough heroin to put a person into overdose. Fentanyl, you can see that it's just a couple grains of maybe like a salt type of substance, so it's so much less that a person without an opioid tolerance could overdose on. And then carfentanil is another class of opioids that's used more like for veterinary purposes. Slide. When it's being used for pain management, it can go really well if the healthcare professional and the patient are having good communication and that there is an awareness about the risk of addiction. Some people are using it intentionally for recreational purposes because of its potency. So for somebody who maybe has become addicted to opioids through prescription pills or through other drugs like heroin, they have potentially built up a tolerance. And so they might step up to fentanyl, where it's going to be much less of a drug to get a hold of and still get that same type of the effect that they want, the high that they want. And most people who use fentanyl are unaware of its presence. That's what we're seeing a lot currently, that we are using substances that have been contaminated or are counterfeit. They're being created, and fentanyl is being used as the filler. Since it's being mixed into street drugs and counterfeit pills, we don't know that we're taking it. Slide. So some of the counterfeit pills that people might be buying, like Xanax or Adderall or Molly, ecstasy, they could have fentanyl in them without you knowing. And they can look exactly like the pill that you would buy from a pharmacy. So unless you're buying something from the pharmacy, unless you're being given it by a healthcare professional, don't take it. Or if you do want to take it, make sure that we're testing it to see if it has fentanyl in it, because we can't tell by looking at it. Next slide. We have a metaphor of a chocolate chip cookie. So in a chocolate chip cookie, not every single bite is going to have a chocolate chip in it. If we think about a counterfeit pill, like the Xanax pill we just saw, that Xanax pill might have chunks of fentanyl in it. You might split the pill in half, and some of it has fentanyl and some of it doesn't. Some of it, half the pill might have enough fentanyl to put somebody into overdose when the other half doesn't. So you might be getting the effects of the high that you're seeking or the pain relief that you're seeking, but we don't have control over it because it wasn't mixed by a pharmacist. It wasn't. It was mixed very quickly to turn a profit. That evenly distributed piece is what you're going to find when you get your pills from a pharmacy. Sometimes the fentanyl will be denser, so it might settle to the bottom of a counterfeit pill, and the filler, the mixer, will be at the top. And so that's why if we are going to take a pill that we have not gotten from a pharmacy, it's really encouraged that we test it to see if it contains fentanyl. Next slide. All right. This one has a video in it that I'm hoping will play.
Oh, sure.
This is a 3-minute video on some of the myths and the facts about fentanyl. There's a big concern that fentanyl can be absorbed through the skin. And I'm not sure if it's going to load.
Sorry, hold on. I didn't realize that.
Oh, okay. Sorry about that.
Oh, it's okay.
We roll the whiteboard at Speedy.
Oh. Yeah.
Is there a link in here, Susan?
Totally built this stack. I don't see it. We'll send it out later.
Okay, I'm
Thank you for
sorry.
trying. No
Sorry
worries.
about
So in that video, it is shot at UC Davis from an emergency department perspective of can fentanyl be absorbed through the skin. There's a lot of fear, there's a lot of stigma around it where people are afraid to be around it. They'd be afraid to maybe give Narcan or be around it. Excuse me. A couple of years ago, I was doing some outreach in the town of Park City, Utah. And there were 2 middle school students who died unexpectedly, and there was no known cause of death. They were waiting for an autopsy. And so the middle schools started buzzing, and they became really afraid of touching doorknobs. They became afraid of touching locks on the locker. They thought if these kids died from an opioid, that it could come through skin contact. And so that's a big myth that we want to dispel. It is a risk factor for like law enforcement that's going in to do like a really big drug bust where fentanyl could go airborne. But fentanyl needs to come through like a mucous membrane in order to be absorbed into the body. And so we want to try to dispel that myth that, that fentanyl is absorbed through the skin. That's something that law enforcement does need to be aware of. They need to put on the PPE when they're working with it. But for the average person who might be working with somebody who's in overdose, we're going to be okay. Slide. We usually encounter fentanyl in a very different situation than law enforcement. We're more likely to encounter someone who's overdosing at a party from a very small but lethal amount of fentanyl to them. And law enforcement is the one that's going to be coming into contact with much larger doses of fentanyl. Next slide. Local impact. So looking at California, this data comes from 2021. In the state, we had 121,000 department visits for opioid overdoses. We had almost 7,000 opioid-related overdose deaths, and 84% of those involve fentanyl. Next slide. Looking at Nevada County, over the past 3 years, we have seen fentanyl impacting our population. The green numbers are showing that they're overdoses. It's not necessarily just opioids, it's any type of overdose. But the orange numbers, 19 and 17, were deaths involving fentanyl. And I want to just take a minute to acknowledge that we're looking at data, but these numbers were people, they were our community members. They came from families, they might have had jobs or pets, and these are preventable deaths. So there's a lot that we can do to help bring these numbers back down. Next slide. Looking at Placer County, we're seeing similar numbers. We had a lot of accidental overdose not involving fentanyl, and fentanyl is starting to really creep in and become a big problem. Next slide. So the approach that Nevada County is taking is called harm reduction. It's a practical set of strategies aimed at reducing negative consequences associated with drug use. The idea here is that we're going to be non-judgmental. We're going to use participant autonomy. We're going to look at some of the sociocultural factors, and we're going to have a realistic view on this. We need to be realistic when it comes to this. For years, we had a war on drugs in this country. We had a zero tolerance policy. That didn't work, and it has escalated the crisis that we're in. So we need to change our approach. We need to look at things through an empathetic and human lens. Next slide. We use this all the time in life. We use condoms, we use seatbelts, we use sunscreen, we use hand sanitizer. There's other harm reduction things that we could have. There's things to take to destroy our drugs. We use pill boxes. You can lock up your prescriptions. There's a lot of harm reduction strategies, and the two that I'm here to really go into depth on are Narcan and fentanyl testing strips. Next slide. So, we can test our drugs with the fentanyl testing strips. We can make sure that if we are using drugs that we're not doing so alone. If we have family members or friends that use drugs, encourage them not to use alone. We can carry Narcan the same way we carry a first aid kit. We can strap Narcan back into our first aid kit and make sure that we're up to speed on what to do if somebody goes into cardiac arrest. What do we do with avalanche? What do we do with a car accident? What can we do if somebody's potentially overdosing? We can focus on not mixing drugs. We can think about the way that we're using drugs, maybe smoking something instead of injecting it, or knowing where our drug is coming from, and then using sterile products. Next slide. So, naloxone is the drug. Narcan is the brand of the drug that we have available. This one's expired, so I'm going to go ahead and just open it up. It has a little flap that has some great pictures and descriptions. Inside, there's a packet of descriptions, and inside it's going to come with 2 kits. Next slide. So, I would open up this kit if I were concerned that someone were potentially overdosing. So what would somebody who's potentially overdosing look like? There's risk factors for someone. A person who might be using multiple drugs, somebody who has new drugs that they have access to that might have a different purity or potency of the substance, somebody whose tolerance level has changed. Perhaps they've been away from the ability to use drugs recreationally, or they've not been prescribed drugs for a long time, so their tolerance level's changed. New supply or product into the market. There's also situational risk factors like using alone, a person's physical health or their mental health, as well as their physical environment. These are all considerations for someone to think about if they are going to use a substance and to do so safely. Next slide. A person could potentially be overdosing if they are unresponsive to sound or touch, if they have slow or irregular breathing, if they're cold or pale, if they've got clammy skin, if their heartbeat has slowed, if they've lost blood pressure, if they're really dizzy or confused, if their fingers, their lips start to turn blue or gray, if they become drowsy, they're really struggling to stay awake. They call that nodding, where somebody's like going back and forth and in and out, as well as pinpoint pupils. So that's a sign that somebody could be using a sign that they could be using opioids, not necessarily a sign that they are overdosing. So again, a very high or very intoxicated person will have relaxed muscles, slow movement, slow reactions, and slurring words. That doesn't necessarily mean that they need Narcan. Signs of a potential overdose is if they're unresponsive. If you're giving them a sternal rub, if you're clapping, if you're making noise, if you're shaking them and saying, "Hey friend," and they're not coming to, that's a sign of a potential overdose. Deep snoring, gurgling, sometimes they call that a death rattle. Their breathing is stopping. It's irregular or not at all. If they have an irregular heartbeat or pulse, pale, clammy skin, or that pinpoint pupil, that would be a sign that somebody is potentially overdosing. Extreme sleepiness if they're not waking up, and that heavy nod. Again, next slide. I'm so sorry. It's hard not to press the slides myself. Next slide. Yeah. Extreme sleepiness, yes, not waking up. So, there we go. What happens? There's that toxic amount of the drug that, in combination with other drugs, could overwhelm your bodily functions, your ability to breathe, and your brain's working ability. In an overdose, it's the opioids are interacting with the receptors to stop or slow the breathing. Our key organs are starting to shut down because they're not getting enough oxygen, and this leads to unconsciousness, coma, brain injury, and then eventually death. Next slide. We have a 3 to 5 minute window without oxygen before our brain damage starts to occur. So with an opioid overdose, surviving or dying really depends on the breathing to get the oxygen into our body. The process is rarely instantaneous. It usually occurs over time. So we do have a huge window in order to step in and intervene. People usually stop breathing minutes to hours after the drug was used, and more often than not, there is time to intervene. So next slide. What do? We want to give Narcan. We want to tell the person, hey friend, I'm going to give you some Narcan. You want to call 911. If there's somebody else there, you can assign them to call 911 or give the Narcan, then call 911. We want to do our best to keep the person awake and breathing, lay them on their side to prevent choking or drowning, and stay with them until emergency services arrive. Next slide. Narcan. Narcan is the opioid antagonist. It's a nasal spray that's available, but there's other types of naloxone that's available. You can inject it. There's one where you can screw a cap on and then give it through the nose. There's an auto injector, but this is the one that's most common in our community. It's going to rapidly reverse the opioid overdose, but it might take more than one dose, which is why it comes in a kit with 2. It's legal to carry and have at any age. It's not a controlled substance. It's not going to get anyone high. Next slide. It can be used on anyone that's potentially overdosing. If I were to come onto a scene and see that someone is passed out, they're not responding, I can give them Narcan and continue on with first aid until paramedics arrive. There's no known side effects. We want to make sure that it doesn't freeze or get exposed to excessive heat. So in a community like ours, maybe we need to wrap it in bubble wrap if we're going to keep it in the car. But there's a statewide standing order that allows individuals and institutions to have Narcan, and we are protected through the Good Samaritan law. Next slide. So how does it work? It's going to attach to the opioid receptors in our brain, and it's going to block the effects of the opioids for about 30 to 90 minutes. In excess, the opioids can lead to that fatal overdose. That's what's causing our body to stop. The naloxone wipes it off, and we're able to regain our functions. Next slide. So in order to apply Narcan, what you want to do is you want to open. You want to, because this one's expired, I'm going to go ahead and pull it out. Open up your Narcan. Next slide. You want to tilt the person's head back and support their neck if possible. Ideally, they should be on their back if that's possible. If you're concerned about a spine injury or something, you'll have to use your discretion. But the most important thing is to get this into their system. Next slide. Give the Narcan, place the plunger on the thumb, the finger against the nostrils, push it in fully, and give 1 dose of the nasal spray, which is 4 milligrams, and then call 911. Again, if you haven't given the first dose, after you've given the first dose, you can start rescue breaths if they are not breathing on their own. Lay them on their back, give 1 breath every 5 seconds for 2 minutes. Before, this was like the only response that we had for an opioid overdose before Narcan. If the breathing is regular, but they're still unconscious, go ahead and move them into that recovery position. If they're not responsive after 2 to 3 minutes, go ahead and open up your second kit and repeat until emergency services respond. I've heard of EMTs who have had to give 4 or 5 or 6 Narcan kits to somebody who's having a massive overdose. And so it's really important to get those emergency responders on the scene as quickly as possible. We don't want to over Narcan someone. So if we can get them to come to with just the first dose, that's awesome. We don't need to give them extra. I gave this training for a community member a couple weeks ago, and they said that they've had to give Narcan to someone in the past, and that person, after coming to and being seen by healthcare services and returning back to their home environment, had said, it felt like I was in the deepest sleep I've ever been in, and I was woken up by a semi-truck just hitting me. So a person that has overdosed and is being brought back by Narcan could be very agitated and experiencing a lot of pain. We don't want to be threatening them with Narcan or anything. We're using this to bring them to so that they can breathe on their own. Next slide. This is the recovery position, putting somebody on their side, using one leg up to keep them propped up and one arm under their head. It can be used for any drug or alcohol overdose situation. That way, in case they do start to vomit, that it can come out without blocking the airway. Next slide. When they wake up, they could be confused. They could be scared, angry, upset. They could be nauseous or sick. The police or a paramedic presence could be really frightening for them. And so we can do a lot by just being an empathetic person, being there to show them that you're there, that you're a safe person, and reassure them with statements like, "You're safe, I'm here, we're waiting for help to arrive." Next slide. The Good Samaritan Law, if you call 911 in an overdose-related situation, not just for opioids, for drugs, for substances, and even for mental health, there are only personal amounts of drugs and paraphernalia around. You cannot be arrested or charged. If there's large quantities or there's other illegal activity, that is a different situation. Next slide. The law provides protection from arrest, charge, and prosecution for people who seek the medical assistance for somebody who's suspected of a drug overdose. And people seeking protections by the law cannot obstruct the medical process or law enforcement personnel, including efforts to secure the scene and to provide medical assistance. When talking with Truckee Police about the use of Good Samaritan Law, they've said that, almost always people have been protected. The cases that they could think of where this didn't apply is when, like, a child was present and there was continued drug use after the overdose occurred. So, something for people that are using recreational drugs, especially if they're younger and they don't know about this law, would be really beneficial for people to know. So some of the reminders: if you're alone, give Narcan before calling 911, or put 911 on your speaker phone while you're going to continue with your first aid response. You can assign it to someone else to call 911. You don't want to leave the person alone after giving the Narcan. It can wear off after 30 to 90 minutes, and it could cause them to go back into overdose. So don't just call them a cab or get them back to where they reside. We want to make sure that they are seen by a medical professional to make sure that that the overdose is completely taken care of. Next slide. So we talked about if you're going to use substances that you didn't get from a pharmacy, at this point in time, we need to be testing them. So these are what fentanyl testing strips look like, and this is what they're being provided in here locally. It comes with a bag so that you have something to test in. It comes with some really in-depth instructions that have lots of great visuals. It's going to come with 3 of these, and then it's going to come with a microscope. Next slide. So when you're testing something, you want to be able to grind it up so that it's a powder. You want to put it in, follow the instructions, put it in the bag, mix it with water, and then take the testing strip, kind of like you do with a COVID test strip, and test. If it comes back with 2 lines, that generally means that there's no fentanyl. So we kind of go this thumbs up. Okay, this doesn't look like there's fentanyl. Do I still want to take this? Am I using it with someone? Do I have Narcan on hand? If it comes up with 1 line, that generally means fentanyl's detected. Let's not take this. You need to stop. Next slide. So if we think about that cookie example, the fentanyl could be present without somebody knowing it. It could be something that if a pill is broken in half, there could be fentanyl in some and not in the other. So we always want to have Narcan on hand. We want to use that buddy system, and we want to have a designated support person there, or call somebody to have on the phone. Next slide. There are a bunch of resources. There are resources at this link that we'll send out to you. Next slide. There is a new campaign, and everyone should have a sheet of paper in front of you on the No Overdose Nevada County. The website went live yesterday. It has Narcan and fentanyl testing strip information about where you can get it throughout all of Nevada County. It's got harm reduction resources and information. It has links to treatment and resources. It has areas where you can request trainings for your organization and other resources and supports. Next slide. For the Speedy Foundation, we are supporting the Truckee-Tahoe area. We have the free Narcan and fentanyl testing strips, which I can give you today. I can talk more about. It was a quick and dirty overview of these 2 types of harm reduction strategies and supplies that are available. We can give trainings. We can show up for outreach events. Our next outreach event is going to be at Palisades for the World Cup. We were just at World Cup over in Park City this past weekend, and it was amazing to have Narcan on the table and to have these conversations. I had a man who prescribes Narcan in his daily job, and he said, I've never seen this. I prescribe it every single day. Every time I give an opioid, I prescribe Narcan. I've never seen it. So we opened up an expired package, and we looked at it. I had somebody who came through and said, I've been prescribed Narcan, but I've been prescribed opioids, but I've never had Narcan on hand. And so she walked away with her own kit. So outreach events are awesome. We do have links to the county resources, and so you can find out more at the Speedy Foundation /Truckee. Next slide. Tahoe Forest Hospital. If you walk into the emergency department, you can go to the front window and ask for Narcan. They're also now distributing fentanyl testing strips. They have training available. It's also available in Spanish, so you can call or text or just walk into the emergency department. Next slide. Granite Wellness has treatment supports. So on western side of the county, you can reach out for treatment support. Next slide. Behavioral health is available as another option. Next slide. Tahoe Forest also has treatment. So they've got the MAC treatment, the Bridge program, and they have a substance use navigator to help somebody who is looking for help. Next slide. So how can you help? In front of you, you have a sheet. We would love for you to take a look at the website. Spread word to friends, to family, share the resources on social media, connect with other people in groups. We would love to continue to provide this training. We will be targeting bars and restaurants, gas stations, grocery stores. We've trained the police department. We've trained the warming shelter. We're in the process of training the school district, and we'll be doing some student trainings. We encourage organizations to become distributors. If you have an organization that has a lot of interaction with people, maybe you want to be a distributor of Narcan. We also have just launched our campaign, and so we would love for organizations to sign on to the campaign to support this work, to contribute your logo, and so there's that on our website as well. Next slide. You can help by making sure that people know where to find Narcan. So we do have some Narcan that's like this, so it's labeled. It can be something that's prominent. There are posters that we have. You can put up posters to say that you are carrying Narcan. Make it accessible, the same way that we have AED that's available. We have fire extinguishers that are available. At this point in time, we need people to know that there's Narcan on site and that it's available. Normalize carrying it. Normalize talking about it. Perhaps you want to become a distributor, and then we can schedule additional trainings. We've got trainings on destigmatizing or dismantling stigma, the foundations of harm reduction, and then we can customize a training to fit your needs. So I'm wondering, after 36 minutes, where could this information be useful? Where in our community does Narcan and fentanyl testing strips really need to be located? Who could
Shannon,
benefit from receiving?
I'm just wondering if I could tag on a little bit.
Yeah.
Yeah.
Oh, sure.
Excuse me. Thank you all so much. That was so great. Gateway is also a part of the No Overdose campaign. And so I just want you all to know that we distribute as well every day, drop-in basis, Monday through Friday, 12:30 to 6, Narcan and fentanyl test strips. We also offer treatment, and we've embedded it into our treatment, and our youth love it. They want to be helpers. So we made these little cards. Any of you that have access to youth, this is a great way to give them the information, let them know it's anonymous. We protect their identity, we treat them with dignity and compassion, and we know very clearly that who they are is not the drugs that they use. Right? And so the youth really respond to that. So I just wanted to add that before we
Awesome.
Switch gears too much. We have big flyers, small cards, and we're here to.
We want to add a slide.
What was that?
And we want to be on your resource list of
Okay.
slides.
We'll have to get into Toby.
We're halfway on the slides, but they didn't make it into his deck. And the website just went live, but yeah.
Yeah. Yeah. Awesome. So, I'm open to your feedback. Who is a trusted messenger that should have this information in our community? who else would benefit from this type of a training? I'm happy to answer any questions and to get that feedback. We do have a training evaluation. Oh, next slide.
Sure, and there is a question in the chat, Shannon.
Okay. We'll take it in just a second. There is a training evaluation, so if you have feedback, I could take it that way, but I'm going to open up the conversation here. You can request the harm reduction supplies through that other QR code, or if you're here personally in this room, you can take it right here. But we talked about the backgrounds and the causes of opioids. We identified the signs and symptoms. We learned briefly how to use Narcan. We talked briefly about fentanyl testing strips, and learned a little bit more about some of the resources in our community. So with that, I open it up to questions and just feedback from our main questions. Do you want to start? Actually, Peter, go for it.
Oh, just a point to add. You mentioned the Good Samaritan law, and that's really important around law enforcement. A lot of us are like wilderness first responder types, and the other half of the Good Samaritan law is you're kind of shielded from liability. Like if you attempt to revive someone and it doesn't work, or the thing breaks, or so I think it's always important, especially for active providers, to add that in.
Awesome.
There's no downside to attempting to help somebody in an emergency situation.
That's how you be protected from liability. Awesome. Thank you. Yeah.
And among the data that you showed for Nevada County, is there more in-depth
Yes.
data that we didn't see about where are those overdoses happening and some of the demographics? Are we mostly seeing them among youth at parties or alone, or are we mostly seeing them among I don't know, houseless adults, or what does that data tell you about where we should be targeting our interventions?
Our data comes from California Public Health, and unfortunately they don't drill in that closely as far as what's publicly available. And so we don't know, we can see where in the county that it's coming from. You're absolutely welcome to come take any of these resources that you see. We have Nevada County, we've got Placer County, and then we have the whole state of California. I don't have that data. Devin, do you have data?
We have some I can share. Yeah, I don't have it at my fingertips, but a lot of it too is it's de-identified data too. Because sometimes if we had 3 overdoses in Glenshire, for example, in Truckee, it could be pretty identifying to some of the families. We would probably know, oh, that was this family, that family. So there's a level of that too where they don't want to totally.
Or even not for the public to know, but do you all know at the county level?
We have what
sense
we
of,
can get.
If we need to be targeting youth or targeting adults, or what is your next step for intervention?
For intervention, I mean that's different than.
For prevention, I guess.
Yeah,
Or-
we're on the prevention kind of side of things right now. Intervention is definitely the treatment and administering Narcan, having it available, getting more people to take this on, more partners. That's kind of where we're at right now. But, yeah, I mean, if I was someone using drugs, I would be terrified of the level of fentanyl in kids at high school, and kids want to score. And I worry sometimes. I'm like, are they really gonna work so hard to get a drug, put it in a bag, test it, learn that whole procedure and process? I'd be really scared of people using Molly or ecstasy or MDMA, which is pretty common in our community. It's terrifying. So it's across.
One thing I want to add there too, with the youth, it's trending right now to go for ego death with psilocybins, and so they want to take high doses of substances, and so one of the main things we're contributing to in this campaign is a series of youth voice produced videos, which it'll be a video digital media lab. They'll learn video editing, shooting, scripting, so there's some vocational training, but it'll be their voice helping each other understand why we want to use these harm reduction practices. So over the next few months, and we have paid positions for any youth that you might know that want to be involved. Please have them contact us. We want to really stoke them in getting their message out and training them in how to make these videos, and they will be paid. So that's another big piece of the youth part of the campaign, of this whole campaign of we got to get the word out. We got to get the word out.
Shannon, thank you so much for that presentation. We only have 3 more minutes just because we are going to launch into another training at 10. And I do want to make sure we hear from the people who are joining us on Zoom. So Kieran asked on Zoom, do you happen to know what date and time we can pick up Narcan at the World Cup?
Yes, let's see. The hours are from 9 to 4 and the dates, I don't have my calendar in front of me, are February 24th, 25th, 26th. Yeah,
Okay, great.
Thursday, Friday, Saturday.
And at Gateway Mountain Center, Monday through Friday, 12:30 to 6.
Okay, great. They should be able to hear that. And then
Yep.
Rocio is asking if we can put information at the casinos.
Casinos.
Yes, we would do that outside of Nevada County. Yes.
Okay. And then would presentation training to Boy Scout troops be reasonable? Have Narcan at Scout camps or West Mountain?
If it feels appropriate, yeah.
Okay. And I presume transdermal fentanyl is a formulation that allows absorption through the skin. They're very slow since they are 72-hour patches.
Yes, yeah, it's time released. And so those patches should be safe for the person that's being prescribed that dosage. What I've seen with those transdermal patches is that if they're discarded like in the trash, an animal could get into them. And then I've known dogs to start overdosing off of transdermal patches, but they can be revived with Narcan. Yeah.
And then Karen is saying thank you both. And we are out of time.
No.
But again,
Yeah.
I really just want to say thank you so much.
We've got about like 4 minutes to come collect any resources that look interesting to you, and I'm always happy to chat with you guys again offline, but we'll get everything reset for the next activity.
Perfect. And everyone joining us on Zoom and in person, we'll make sure to send out all these resources, contact information, and slides.
Awesome.
Thank you.
Good job, Shannon.
Thank you. Thank you. Hi. Would you like anything?
Yeah, so you like if you have a first aid kit, would you just